Medical student well-being during the COVID-19 pandemic. During the initial stage of the COVID-19 pandemic, U.S. medical students were suspended from in-person clinical interaction. This decision was based on specific guidance from the Association of American Medical Colleges and subsequently implemented in medical schools across the United States. Our research projects addressed students' stress level before and after clinical in-person suspension and assessed medical students' perceived COVID-19 related risk level. We were particularly curious to learn about students' emotional struggles as they navigate the initial pedagogical uncertainty associated with the pandemic. Our study showed that students had a significantly higher stress level after the clinical suspensions of in-person clinical interaction as compared with the time before the suspension of clinical in-person interaction. It is likely that heightened stress was greater than before, and the rationale was likely multifactorial in nature. One key challenge U.S. medical students faced was the negative impact of COVID-19 on medical education. U.S. medical licensing exam taking was severely impacted, and some students need to reschedule their test days because of increased restrictions at testing centers. Third-year medical students in particular were worried about how COVID-19 would influence their residency application. For example, in-person residency interviews and away rotations as fourth-year medical students. Another concern was not being able to be involved in clinical working during the direct state of this public health emergency because of personal protective equipment shortages and attempts to reduce community spread of COVID-19. Our study also showed that students have relatively lower perceived risk level when it comes to COVID-19 than healthcare workers. In 2003, SARS pandemics, which we suspect is mostly attributable to the suspension of the clinical in-person interaction. We also found that the female gender and self-reported mental illness diagnosis were two risk factors for perceived stress level consistent with our current literature. Right, the reality of clinical in-person inaction caused by PPE shortage and limited telehealth options, together with social isolation and uncertainty regarding future education opportunities, appear to have had a detrimental effect on medical students' psychological well-being. This did not have to be the case. Some medical students found innovative ways to stay involved. For example, in 2020, some of Dr. Zhang's classmates helped proctor virtual group therapy sessions held by the local National Alliance on Mental Illness chapter. Medical students at the School of Medicine at Mount Sinai, New York were not only able to engage in telehealth but also join other task forces such as PPE supply, distribution, and coordinations, moral promotion, and administrative services. Finally, many medical students in New York volunteered in providing child care for frontline doctors to help relieve the burden. These actions, if implemented more widely, may have had a protective effect on the stress and well-being of medical students at that time. While our studies focus on the academic side of things, the personal impact from COVID-19 need to be acknowledged. Sickness from COVID-19 and its sequel, family loss from COVID-19, financial struggle, and racial targeting of agents, to name a few. COVID-19 has influenced many families' livelihood and changed our understanding of ourselves, others, and the world in unprecedented ways. Fast forward today, medical students are used to learning and living in a world with an ongoing pandemic, and medical education and residency application process have adapted to this new normal. The one crippling uncertainty surrounding COVID-19 and disastrous PPE shortages have passed, yet COVID-19 continues to be a treasure. In fact, burnout related to COVID-19 fatigue has been on the rise, and one recent national survey shows 1 in 5 physicians intends to leave practice within 2 years. Meanwhile, uncertainty continued to persist as in August 2022, monkeypox was declared a public health emergency in United States. What Dr. Yang learned as a medical student during the initial months of COVID-19 continues to be relevant. Connect with loved ones, understand the changing reality, process the emotions, recognize what is under one's control, have a solution-oriented mindset, and be forgiving and patient with oneself and others. Trong suốt giai đoạn đầu của đại dịch Covid thì sinh viên Hoa Kỳ đã bị cái việc học ngừng cái việc tương tác